Hello, my name is Nicole Cox, and I'm going to be talking about IV placements in school-aged children. The first thing I'm going to talk about is the reason for treatment. So, the reason that a school-aged child might need an IV placement is one, to get their blood drawn, two, for medicines. If they need medicine that's going to act quickly, they'll get an IV for that, or if they are very dehydrated and they need water in their system as quick as possible. The next thing I want to talk about is the sequence of events that happen when a child gets an IV. First, the nurse will review the patient's medical records and identify the patient. Therefore, the child is going to be questions such as their name, their date of birth, and stuff like that, so they know that this is the right person. Next, there will be a reiteration of what exactly is going to happen to them. So they're going to explain why the child's getting this and what is going to happen. While they probably have gotten that talk done before, it's good to reiterate all the things that are going to happen to them right before they go in to get the treatment done, so they feel comfortable going in. Next, the child will be asked to put their arm to their side in a comfortable position while they're sitting in their chair on a chair or armrest or on the table next to it. After that, a band will be wrapped around the arm so that the RN can find a vein to insert the IV. This will be tightly placed right here, and they may tap a couple times. That tries to bring the vein to the surface with the blood inside, so that the RN can find the right area to put the IV. The area that the IV will be inserted will be wiped down with an alcohol pad. This will feel cold, and it'll smell a little bad. They're doing this so it cleans the area. After that, the IV will be inserted and the treatment will be done, whether that's the blood being drawn, the medicine, or water going in. That'll be done then, and then the child will be asked if they're doing okay, giving them questions, keeping them distracted, and then after the treatment's done, the IV will be removed. After that, there will be a cotton ball placed on the spot to just make sure it doesn't bleed, or if it has a little bit of bleeding, that it's stopped, and then a Band-Aid will cover it. Next, I want to talk about the medical staff involved. So the first one I want to talk about is the child life specialist. So the child life specialist is going to try to make them as comfortable as they can in a very uncomfortable position that the child's in. They're going to work with coping techniques and make them feel as normal as possible, and make them try to ease some of the anxiety and fear that children get when they get inside the hospital setting. The next person is the RN. The registered nurse is the one that's going to be asking the medical questions and actually doing the treatment. And then lastly, family members may be present. That includes mom, dad, sister, brother, anyone who takes care of you. Those people can be there. Next, I want to talk about the sensory information. So the first thing I want to talk about is how the band is going to feel. The band will feel really tight and maybe uncomfortable. That will depend from person to person, but your arm may feel like swelling or the blood is rushing. It's also important to explain that the vein is going to become blue. You can see on your arm down here that these little veins are blue. It's going to look about the same up here. The veins are just going to be a little bit bigger, but it's nothing out of the ordinary. You can even explain to the child that the blood inside of our body is more of a blue-purple tint, while when it hits the outside air, it turns more red. Next, I want to talk about the alcohol pad. The alcohol pad is a small white cloth that's soft, and it'll feel cold when it hits your skin, and it may smell bad. It may smell like nail polish remover or anything that has that strong cleaning smell. When the IV is inserted, you'll feel a small poke or pinch. However, this pain will kind of go away while it's going in. You're going to feel that pain, and that pain will vary from patient to patient, but the pain will go away when the IV is inserted because you'll kind of forget that it's there. However, when they remove it, it's going to have that same kind of feeling, but it's not going to be that pain. It's not going to be too bad. The arm may also feel sore for the rest of the day, and it may bruise, but it won't feel bad for more than 24 hours. Next, I want to talk about the developmentally appropriate information. So I'm going to explain the sequence of events, but in a more developmentally appropriate way for school-age children. So first, the nurse will be asking you questions so that you can make sure that you are the person who needs this treatment. This will include things such as your name, date of birth, and things like that, but nothing hard. A nurse will wipe down your arm with a small white cloth that feels cold and may smell bad to you, like nail polish remover. This is an alcohol pad and will clean the skin before the IV is inserted. The nurse will tie a stretchy band around your arm. This helps bring more blood to your veins, so it shows and the nurse knows where to insert the IV. The vein will look very blue to you, almost like the ones near your wrist. That is very normal, and the blood inside of our body is blue, not the blood that you see when it hits the air. So these veins will look very normal. It'll go back to normal when the nurse takes the band off, or later when the IV is taken out. It won't stay that way. After after the nurse finds the particular vein, the IV will be inserted. This will feel like a small pinch or poke. However, once the IV's in and you kind of take your attention away from it, you won't really feel it anymore. When we go to take the IV out, you're going to feel it a little bit again. It's going to be that same pinch or poke feeling, but it's not going to be too bad. Later on, you might feel a little soreness, almost like you got a bruise there. That will go away within 24 hours. We'll put a Band-Aid on at the end. That will just it won't be bleeding or anything profusely, but that cotton ball will make sure that even if there is a little excess, that we can just make sure we cover that up. Okay, lastly, I want to talk about the coping techniques that the child life specialist can use. First, school-age children have anxiety about their life, how their life may change after being in a hospital, and that creates a lot of the anxiety they feel when they come into the hospital setting. This being said, the child life specialist should explain to the child how their life will be the same after the IV. So one coping technique is just explaining to the child that everything that they are doing now, they can still do after they get this treatment done. There will be nothing stopping them from going back out and doing those same hobbies and stuff. School-age children need to get their lives back to the way they were as soon as possible. They become really increasingly aware of their own lives at this age, so their friends, school, and the hobbies they're into. They don't even want to miss school because they don't want to miss out on their friends. They don't want to miss out on any practices they have to go to or any clubs they might be a part of. So the quicker that the child can get back to the normal, their normal, the easier it will be for them to cope for the situation, and the more you explain to them that it's going to happen basically right after the IV, that will help them feel better about getting it done in the first place. While in the hospital, it's important to explain everything to them. School-age children have increasing wonder at this age because they are in school, they are learning, and they're learning to teach themselves, and they're learning to ask questions. And so it's important that we allow them to ask those questions, and we even let them experiment, play around with the things that they may have wonder about. That will help them feel more in control in a very uncontrollable situation because they'll feel like they know what's going on better. It's also important to explain to them. You can explain to them the equipment in a more scientific way, so you can tell them what everything is. You can be more specific on what everything is. That goes for the body parts that are involved too. You can be more specific in those things than you can with the age group below them. Another way is to allow them to express their feelings. This age group likes to talk about themselves, and they'll like to do it a lot. And if you let them start talking about themselves and get those feelings out, you may be able to find things that they're feeling that they weren't ready to open up to you at first, but now they are, or things that you can help ease their minds from if you just allow them to talk and get those feelings out and express themselves. Lastly, explain to them how their situation is similar to others. They're, like I said earlier, they're very into their peer groups and at this age, and they want to be with those those peers and they want to be in school and all that stuff. So you want to explain that many children are going through the same thing as them because they want to feel a part of that, just like they feel a part of school and a part of their friends. So they want to feel a part of something and they don't want to be left out like they're the only one going through it. So if you explain that there's a lot of other children that have to get the same thing, that'll make them their anxiety ease just a little bit and will make them feel better about the situation. And that is all I have. So I hope you learned a little something about IB placement in school-age children.